Good evening, everybody. My name is Caroline Kinsella. I'm the Health Director. We're starting our Board of Health meeting tonight. Tonight is March 2nd. It's 7:02. And I am going to just kind of go around and introduce everybody. If everybody could just wave, and I'll start with myself. As I said, Caroline Kinsella. I'm the Health Director. Carolyn Ho. She is our health agent. Jean Peterson is our clerk. Roxanne Musto is our chair. Laura Richards, our board secretary, member Mary Stenson. We got also Lisa Courtney. She's our Mass in Motion coordinator. I see Mariah on from the Milton Times. And Pat Lattimore is here also. Hi, Pat. Thank you for coming on tonight. All right, I'll start it up. I don't see anybody else in the waiting room. Carolyn Ho is also co-presenter. So if you can keep an eye on the waiting room, that'd be great. Carolyn, thank you. All right, so call to order. And number 2 is Citizen Speak. Anybody here for Citizen Speak? No? Okay, I'm going to move along to number 3, approval of the meeting minutes from the January 12th, 2026 Board of Health meeting. Board, have you had a chance to look at the meeting minutes from our last meeting? Do you have anything you'd like to change or add?
No, I read them. I don't have anything to change or add.
Yeah, I have no changes.
I didn't either. All right, I'll make a motion that we approve the minutes from January 22nd. Is there a second?
Second.
Okay, and I'm going to do a roll call. Laura?
Yes.
Mary?
Yes.
And myself, yes.
It was
So those are
January
done.
12th. Did you say
Yes.
22nd? 12th.
I thought I said 12th, but I probably might have said 22nd. So
You
correction,
might have
the
had
12th.
Okay, great. Thank you.
Yeah,
I'm
thank
having
you.
problems with my ears. So you might have said the 12th. Thank you.
Thank
Okay,
you.
so moving along. Number 4 is discussion with Equity and Justice for All Advisory Committee. Thank you, Pat, for coming on. And Pat has a presentation. If Carolyn, can you pull that up? She has a couple of slides that she's going to go through. There you go.
So, good evening, everyone. Thank you for having me. I really appreciate it. I know that you have busy agendas, and the Equity and Justice for All Advisory Committee really appreciates having the time with you. As I told Roxanne and Caroline, that I wanted to put together a couple of slides just to have some framing or context for our conversation. And so these are not meant to be anything, specific. It's just maybe a little bit. First of all, I'm going to tell you a little bit about us. And then secondly, I wanted to maybe talk a little bit about why we're coming to you this evening, and to have you think about how you would want our relationship to go in the future. So if that's okay, I'll go to our charge. And some of you probably know a little bit about the Equity and Justice for All Committee. The committee was set up in 2022 by the Select Board, and it was set up as a lot of things politically in the country was happening around equity for people of color in particular, but just in general, like all of the upheavals that we've had over the last 4 years. The committee is charged with reviewing town policies and procedures and budgets for the purpose of advancing equity and justice for all Milton citizens, but especially for people of color. And immigrants of color also. I can tell you that in 2023, we made a presentation or final presentation. We were a temporary committee at that point, and we made a final presentation to the board, the select board. And what we asked them to do, we gave a number of recommendations, and they were in 5 areas. It was around the government itself in terms of how can it be more responsive to all of our citizens and all of our residents. Um, Also, we talked to a number of issues that we had brainstormed, and it was things like the schools and youth, like how to make the town feel more welcoming and involved for everybody. And then we talked about affordable housing. And you probably don't remember back then because things have so much changed in the last 4 years. There was a whole thing about the ADUs, or what some people would call granny suites. That's since been resolved by the state as they've changed the zoning for the entire state to allow accessory dwelling units. And then we also talked a lot about police and fire, because we were looking at the town, the largest departments, and thinking about like what could be done in terms of making sure that um, you know that everybody was aware of what the town and all of its diversity and trying to help people to reach out. So I'm going to stop for a second because that report was very important to us, but one of the big recommendations was to have a permanent committee that would continue to work with town committees and the staff of the town to ensure that this wasn't something that was a one-time thing, that we would have some discussions around equity and what should the town be doing. I'll tell you, if you go to the next page, thank you. Thank you, Caroline. These are the members of the committee, and as you probably can see, some of them you probably know, but we're no experts in this, and we say this up front. We feel like we're on a journey, and a part of what we want to have happen is to open a dialogue so that everybody can be engaged with it about where does the town need to go to ensure that all of our citizens are engaged and feel a sense of belonging here. In some instances, we have actually, gave recommendations about specific things like there was an equity audit done in the town for town staff. But one of our pieces, as you saw in the previous slide, was to really think about what are, all of the communities of the town. And this year, our goal is to have these discussions with you. How we've done that is that we looked at most of the elected committees and boards, and we've assigned people to them to act as a liaison. And I have been assigned to work with the Board of Health. So I'm hoping that this is not just a one-time thing, but something that we could have a discussion over time. As I said, I'm not here to tell you like how to do your work because you are the experts in that. But I am here to remind you that everyone in town may not be as connected as we would hope them to be. And I know, especially with the health department, because I've read your reports, that you're really aware of that and have been doing some good work on these. And so the goal is to really think about how can we each get better to bring more people into the fold to make everybody feel like this is their town and to be able to contribute at whatever level they think or find is appropriate. So I'm going to stop for a second and let you ask if there's any questions about who we are or what our role is with you and why we're even here tonight.
Or do you have any questions?
Well, I'm going to assume that there is, but stop me at any time, please. And I'm going to say that we are visiting all the boards, or trying to visit all the boards. And how we're doing this is that we picked like the ones that we thought were some of the, the ones that were more visible to people. And so, we're talking to Parks and Recs. We're talking to the school department. We're talking to you. And so those are the big organizations. And so, as I said, our goal is to talk to all, eventually to all of our elected officials and boards, and to understand what issues that you're concerned about around equity and justice. We're not, our goal isn't to give you any solutions or make any recommendations around your work, but to actually to spark conversations. I came up with, 4 or 5 kind of questions or considerations that I thought would be helpful to guide this conversation. And so if you would bear with me, I'll just kind of go through this and then maybe we can have a dialogue. As I said, our goal is to really talk to you over time and to be a resource to you. Because we know that these are difficult sometimes conversations to have. Probably you more, as well as others boards, deal with this maybe a little bit more than some others, because you're dealing with, such broad swaths of the community. But we know it's hard. We know the work is hard. We know that, people don't share, have a common basis for understanding many times, um, like whether the work, but I think of it as very simplistic thing, and I'll say that up front, and that is, I've lived in this community for 30 years, and I think it's a great community. I've raised 2 boys here, and I felt like I've had opportunity to become engaged with the town in a lot of different ways. Um, and unfortunately, I feel like sometimes when I talk to other people, and also we find this out through the survey, we did a survey back in 2022 of the town, and we found that, a number of people, especially people of color, but not just people of color, it could be also the LGBTQ community, and sometimes people with disabilities. I mean, a number of people felt like the town isn't easy for them to understand and to become engaged with. And so it's really just, so what we're hoping for is to create more engagement so that people can build a sense of community within town and with its structures. So I know that that's a lot, but that is how I approach it. And I'm sure you all have your own ideas about how to do it. But I'm here tonight to listen. I'd like to talk about, as I said, like kind of these are just framing points. There's nothing special about them. They're just what I put down. And that is, does your committee, your board have any concerns related to serving the towns? And I call them most marginalized, but also many times least engaged. Because a lot of times it's just that they don't know how to engage, right? Um, even simple things like you'll tell people, and I won't use you, but I'll say, I've heard, and we all have heard this, I'm sure, that you'll have that people just don't know what to go, uh, where to go and how to engage. And, a lot of times I know that the Milton Times is here, but if you don't get the Milton Times, you may not know a lot of key dates of things. I mean, I think everybody's trying to do more and to make sure that we're outreaching to people, but there isn't one way to do that because one vehicle doesn't cover everybody. And so we recognize that. And so one of my questions to you is, what have you thought about this in terms of how do you reach people who either they may be new to town or they may be older in town, but they haven't had the opportunity to engage, especially with the Board of Health and all of your programs. Um, and then I had a question about if you have thought about it, have you identified specific priorities? Um, and if you have, then what are you doing to address those? Is that a part of your work for the year, right? Um, and as I've said before, is what's your outreach strategy for people? Because a lot of times, I find it, and I say it for myself, that you just don't know what you don't know. Um, I'm a, avid reader of a lot of the publications that the town, like on the website, or I'll look at the Milton Times. However, a lot of people don't do that, and also, frankly, the town's website isn't the most easily navigated sometimes to find out stuff, right? And so if you have a problem that you're trying to figure out, like, how do I get to who in town does A, B, and C? How do you figure that out? Because we do have great resources, and I would say the Board of Health is one of those. And then the last question I would have is, what help does your board need from others, including us and the Equity and Justice for All committee? Because this isn't work, we're not looking specifically and saying, oh, you have to do all this work. This is work that all of us have to do. And, it's the small things and sometimes the large things that make a difference. And sometimes you can't do your work because others need to do their work to help you. And so I'm going to stop talking. But does this make sense in terms of a context for having a discussion?
It does, Pat.
Mhm.
You may know we did a community health assessment and
I
gathered the
participated in
data. Yes,
it.
yes, for a
Mhm.
year and a half. And one of the things you're right is inclusive communication that was identified as a strategy for
Mhm.
the next 5 years. So you're
Mhm.
right. The ways that we communicate with the public is through our website and Facebook. Um, and many times we get calls from people asking questions, and we're directing them so access to care of where they need to get help. It may be our social worker asking. They might be asking for behavioral health resources. Or we have our mass and motion coordinator, Lisa Courtney's on today, about food.
Caroline, you went mute.
Oh, I don't even
Sorry.
know where I left off. Where
You
did I
were
leave off?
you had just said that you have your website, your Facebook group, and your social worker. That.
and and when people come in, we can like access to care, point them in the right direction. Our social worker, behavioral health resources. We also have Lisa Courtney on the call, and she's our mass emotion coordinator for food resources. We do emergency food bags, and also I don't know if you're aware, we also have a language line. I think we're the only one in town hall that has it, and it's paid for by our shared service grant for our health departments. And
Mhm.
it is very helpful because if someone came into the office and they didn't speak the English language, we could actually call a phone number and do a three-way call, and
Mm.
we could be able to converse with them. And this has been very good when we have some housing cases too.
Mm.
If we need to be able to talk to a tenant or a landlord,
Mm.
we are able to contact them and use this interpreter line very easily, which is great. I think we're the only one in town hall that has that.
Yeah,
So to be
I
able to
wasn't
do
aware of
something like that
that.
is very good.
And Caroline, how often does the I'd say like more general public reaches out to the health department?
We get calls every
How
day
much, I
about
mean, how
different.
much,
Yeah,
like some people you
yeah.
do, like so for example, Public Works, they're going to have people call them because, your street hasn't been plowed or the garbage wasn't picked up. And, it's always a complaint, I'm sure. But like what kinds of and what level of communications do you have with the town, with
So,
residents?
yeah, so residents can call us about a number of things. As I said, it could be about food access. It could
Mhm.
be about mental health.
Mhm.
We also get complaints about trash, even though we try to send them, to DPW, but complaints about rats, complaints
Oh,
about neighbors, complaints about housing conditions.
mhm.
So we get a variety of people calling about different things that they're concerned about in the community, and we always um, direct them to where they need to go.
Mm.
Carolyn, are you putting your hand up?
Yeah, I would say being one of the people who picks up the phone mostly, I say at minimum we get like 2 to 5 on like the less busy days calls per day. And most of them are just like, today I got a call about sub-metering forms for someone wanting to rent, like
Mm.
random questions that we get a lot of calls about septic. A lot of people ask us about our sharps disposal program.
Yeah.
A lot of people call about that. I'm trying to think. Yeah, a lot of just like environmental nuisance complaints
Mhm.
that I address. Caroline helps address a lot of those too.
Mm. And so, do you get a sense? Because I mean, I think that's a pretty good number of calls, 2 to 5 a day, asking for things. And clearly, people are seeing the department as a resource for them. Um, is it from the same? Do you get a sense that, people in general know where they need to go, or what you all do? So for example, I'm not surprised that you get the things like like what I would think of more as the public works department, you know what I mean? Like, oh my gosh, there are rats in the house or whatever, or garbage that's not been picked up, but on the other hand, it's kind of good in a way that they think that the health department is where they can at least start.
Yeah,
So
we've
do
had
you
lead
get that
complaints.
sense that people just feel like this is a
Yes.
place?
So we've had lead complaints, asbestos
Mm,
complaints,
mm,
water complaints. So you name it, we've got it. We always try to be respectful and help the community or whoever's calling to
mhm,
direct them. And if we can help them in any way, we do.
mhm,
Yeah.
I will say I feel like we get a lot of calls like that relate to our department, but the other half of the time we either have to transfer them to engineering, building, or public works, I would say.
mhm,
So
mhm.
we kind of like steer them in the right direction, but they kind of start with us.
Well, that's good though, because as I said, I think that when people are thinking about public health, I mean, those are issues of public health. They just happen to be dealt with by somebody else other than you. How about for your programs? How do you, you know, outreach to people? I know you do things like flu clinics and, there's a lot of information that you try to get out to the community. Um, how do you, and I guess I'll look to you, Caroline, to see, like how do you like make sure that as broad a cross section of people as possible know about those things?
Yeah. So again, the Milton Times is here. We advertise in the Milton Times. We put
Hmm.
it out on our channels, Facebook. Carolyn puts it out. People call, and we have it on our website. They can call into the health department and make appointments for the seasonal flu clinics or any of
Yeah.
that.
Caroline, you make a good point too. You're very intentional with your presence at all the community events,
Mhm.
and I think the signage is good when we need to get messages out. We use the board. We use that digital board from the police department. Uh,
Mhm.
Isn't that shared, Caroline? And
Yes.
then, of course, data is very important because that's data drives, you know, what you need to do. So we're always, I think, uniquely in nursing in general, um, it's data driven. It shows need. So I do know you're always looking at data, Caroline, too. And you're
Yeah,
very identifiable because when you go to the community events, you have your jackets on that label what department you're representing. And that's what the staff has quite a presence at community events. And you've gone door to door too. You've gone and done you've particular conditions that people have had. You've had to go to the home, and then you've gotten positive feedback because the neighbor said, anyway, they had to disclose to their neighbor what they were doing. But you have done that as well, which touches when you do something like that. It touches more than just that person. Depending on what's going on. So that's a positive thing as well. I think Ann Grossman too is very sensitive to needs. She meets in a private space with people, and she's very open to everything because that's her job. But they have a space delegated for particular sensitive conversations someone might want to have and things like that. So that's another positive thing.
What kind of outreach? Because I do know, and I feel like because I've been around for a while, and so I do see like the digital boards and things like that. But so many people probably just drive by those things, and
Maybe, yeah.
you know what I mean.
Yeah.
But especially, I was thinking about for like folks who are not engaged, and I would say, a lot of times those are people of color because they're relatively new to town. They may be more weighted toward renters or new. I know when I first got to town, I happened to live in a great neighborhood. So, my neighbors would come over and say, "Oh, there's a flu clinic or something," or the kids would bring something home in their backpack, right? And I would be like, "Oh, there's something happening." Um, and some things, I do, and I'm not pandering, by the way, to the Milton Times, but I do read the Milton Times pretty religiously. So, I see those types of things. But but I also am aware that, not everybody does that. And as I said, despite like there's a big old digital board and people don't necessarily see it. Like, you go past it and I'm like, oh, because sometimes I've done that. I will be like, oh, that's just about something I'm not interested in or something. But how do you reach people that are, you know, like not as engaged in sort of the way that the town work?
I was just going to say a couple of things. I think these are all really great points. I wanted to say something about Ann Grossman, which is great. She does spend some time at the library,
Okay.
and that's a great access point where people tend to go. And she has some hours there. I know when we did the flu clinics this year, I had talked with Caroline, and Caroline had talked with the library director about doing we had, flu vaccine to do like a clinic or two there, if I'm correct. And I believe he might have put that out on his newsletter or his email blast or whatever. I think the schools, I believe, do they put that out as well when the town does the
Yes.
flu clinics? So, there are some other mechanisms as the times, of course, but I hear it's hard to reach everybody at all times. So I think a lot of times word of mouth, from different people spreads around town too. And like you said, your neighbors and things like that. So there's always room for growth for sure. I think we've done some creative things trying to reach people too. So, and I know in the past we've even talked about that, whether we do a flu clinic and we do a drive up, you drive up in your car and you get your vaccine. I think we had talked about that a few times as well. So, I mean, I think, I think the other thing is Caroline's part of a group of towns, the NC8. I don't know if you want to talk a little bit about that a little bit more and how that works. and what towns are surrounding us that are part of that. That might be good just to let Patty know about as well. If you want to talk about that,
What's
Caroline,
it called,
quickly.
Caroline, again, or
It's
Roxanne?
it's called it's called Norfolk County 8.
Oh, okay.
Yeah, and actually it's down to 7 towns now because Needham is not in it anymore. But it's Canton, Wellesley, Norwood, Westwood, Walpole. Who am I missing? Walpole, 1, 2, 3, 4, 5. It's one more. That's me, Milton. Yeah, so that's how we pay for the shared service,
Mm.
the shared service language line.
Oh, okay.
And we also have an epidemiologist that's able to create notices for us.
Mhm.
And so it's someone new that we've hired, Sarah Lavari,
Mm.
within the shared services, and she's developing some promotional materials around whatever's going on, whether it's mosquitoes or ticks, whatever the
Mhm.
season is, and then she
Mhm.
sends it out to us to send it out further into our communities.
And how
And
do you get those two people? Because, you know, I don't know, I guess, is like, how do people, like, say, for example, like, what's the most popular types of things? And how do you make sure that, people get the notices? Like, so for example, I mean, maybe since you mentioned mosquitoes, um, how would people know what's going on around that?
so they have to go to the town website about the mosquitoes.
Mm-hmm.
So we do notices about any kind of spraying that's going on in town,
Mm-hmm.
and that those are regularly coming up in the spring. So we'll put information about that out on our
Mm-hmm.
town website.
Mm-hmm.
And
So is
isn't
there
it, I'm sorry, isn't it
any
on the cable as
specific?
well?
What was
I'm
that?
sorry. I was
No,
just
I'm
saying, isn't
sorry.
it out on our cable TV as a notice as
Yes,
well?
yes,
Oh,
I'm sorry
yeah,
to interrupt, Patty.
no, no,
I
no.
just
I'm
wanted to
sorry
get
I
that point.
interrupted you.
No, no, I
Yeah.
did. So sorry.
yeah.
But yeah, it's on usually I've seen it scroll through on the channel 8 or whatever,
Mm-hmm, mm-hmm,
as well. Yeah.
mm-hmm.
Sorry.
Yeah. No, I just wonder, because like if you are, I mean, it's hard to know what you don't know, but for people who speak that English isn't their primary language, um, I mean, that's one of the things that I went to the Milton Health Coalition meeting in November, and you know, I was thinking that one of the things is that how do you even know that certain things are happening? Because and I know that that was one of the things, the town website became a topic with the town administrator in particular about how do you navigate it, and is there a different or better way for people to communicate with each other? I'm just wondering, as a department, do you do specific I mean, so you have it in different languages, but how do they actually get to people?
I see Lisa Courtney on here. She can. I'm just going to grab a water.
Hmm.
If you wanted to explain about the food access guide and the
Hmm.
translation.
Sure. So one of the things that we translate, because we know that English isn't the only language that people
Hmm.
use in Milton, is the food access guide. So since I've been in the department the last 2 years, we've translated the food access guide, which is regularly updated with information on where people who need food resources can go, the 2 food pantries here in town.
Hmm.
And this stuff is constantly changing, especially since the SNAP fiasco in November. There's a lot of things that have been added. So those are available in different languages on our websites, but
Hmm.
people do have to go looking for it.
Hmm.
Not currently pushed out to people.
Hmm.
So another connection we have is the Milton Interfaith.
Yeah.
I always get Mika and Micah. Which one do I say? But the interfaith clergy,
Micah.
Micah,
Hmm.
Micah, I'm also in touch with Micah to share
Mhm.
information, and I think they definitely know who we are and know that if they have congregants that need our help, they know where to find us.
Mhm.
There's a variety of ways that other towns are doing language access work. We have worked with MAPC, the Metropolitan Area Planning Council.
Mhm.
One of their no cost things that we can do is keep learning about plain language. So that's communicating with people instead of in our, jargon of municipal speak. It's, writing it at a ninth grade level so that not only everybody who speaks English can see it, but also it is sort of primed for translation.
Mhm.
So Google Translate is definitely not the best tool to use, but it is better than nothing.
Right.
And it's free. So it's easily accessible by everybody. So plain language is sort of the first step
Mhm.
in that. And Caroline and I are actually going to be surveying all of the department heads in town in the next couple of weeks about how they currently help people who come into their offices and aren't speaking English,
Mhm.
and how
Mhm.
they figured out that as a baseline, so as a
Mhm.
place to move forward from, because we
Mhm.
know that it's our services in that area are not as robust as they should be.
Mhm. No, I love that. And speaking of the other departments, do you have, I mean, the same way that you act as almost like a triage for other town services, do they also refer people back to you? So I was just thinking, like I happened in my family, there's somebody with a chronic disease. So when you mentioned, I don't know which one of you did, but the SHARPS program for a number of years, I was like, what do you do with these things? I came from Boston originally, so the hospitals used to have drop boxes outside of them. And then when I came to Milton, I was like, I guess, and I know you can put them inside the box and put them in the waste, but I felt wrong about that. And so, and so I'm sure many people have questions like that, but then like like me, I call Public Works and I said, well, what should I do? And by the way, they did refer me to the health department and said you could go there and drop them off. But I was just wondering, do you get that kind of feedback from the others? And how do you encourage that? Like, does the town have sort of a little bit of you know, a network where you all talk and say, oh, like, I noticed that there are a lot of people who are asking about sharps and, putting them in the garbage or whatever. So do they come to you too in the same way that you're saying, oh, go to public health? I mean, go to the public works department.
For Sharp specifically, I know we work with the environmental coordinator, Cassandra. She works in like the engineering department, but she's like our main point of contact for trash. Specific using this specific example, so
Yeah.
she'll reach out to me for information about the Sharps program, so she can add it to like the trash pamphlets that
Yeah.
residents get,
Mhm.
just so they have the correct information. Because I know before she started working, the information about just the fee was wrong about that because no one had reached out to us to update it.
Mm.
So we did have a resident come in and she was like pretty upset because the information wasn't translating to what was active with how we do the program. So I know there was like a little bit of miscommunication with that, but I do work with Cassandra to get that
Mhm.
updated information out there to residents when they get their trash information.
That's great to hear. And as I said, but I was thinking, because I think there are a couple of examples like that. You mentioned about the school. I mean, and obviously it's still happening. When I had kids in school, I would get a leaflet in their book bag about the clinics that you hold. Um, but I don't have kids anymore in school, so I haven't seen one of those in a long time. And
So that
so,
may be another good thing for you to learn about, since you don't have kids in the school anymore, is they call it the virtual backpack. So instead of
mhm,
actual paper going home to everybody,
mhm,
it's a link on all of the principals' newsletters. And I don't see why the public can't, have that link too. I'm going to find it in my own email and send you the link, or maybe I can put it in the chat here or something too. But that's another way that a lot of information in town does get shared.
I think that's a great idea to, because I don't know, as I said, that's what I meant by, are there other people? Because you can't do it all, you know what I mean? As much as you're dependent upon the town's website, the schools have kind of a captive audience, with parents at least. But I definitely noticed that as my children aged out of school, that I had less information about what was just going on in town. Like whether it is, around mental health counseling, drug abuse, or whatever, like unless I see it in the paper, I just don't know anything about it. You know what I mean? And so I'm just wondering, and that's something I think that as a town, we should talk about, and maybe as the health department, because you seem to be open to it, that we could actually think about, like, how do you reach a more diverse population? One that as a push strategy to people. And I love the virtual backpack newsletter or whatever it is, being more of a resource to more people because and I'm sure you've all thought about this, and so I'm new to this, but I'm certain I thought, like, if you wanted to know when something was happening, and whether it's a flu clinic or whether it is, I don't know, I know during the winter, I did call the health department regarding COVID testing supplies. And so, it's things like that I think it's almost like, you need it when you need that kind of information, but you don't, like, you have to really think, well, where do I go? How do I find this out? And so is there a place where, and Carolyn, seems like, where you can get, like, what's the, most frequently asked kind of questions. And I would assume that it's seasonal, but I don't know that for a fact. But, like in the winter months, like people are probably asking about flu clinics or COVID test. In the summer, I don't know what they're asking about. Mosquitoes, maybe, I don't know. And I know that a number of people are concerned about things like, the spraying in the town. And it's almost not even about when it's happening, but it's like, Carolyn, you said about information, data, um, like what are they spraying? How hazardous is it to people? Or is it hazardous? And those types of things, So those are things that I think people come up with, but they may not necessarily reach out. And I was wondering, like, how do you get information out to people?
Yeah, sometimes they do reach out about the mosquito spraying.
Mhm.
And then I direct them to the Norfolk County Mosquito Control
Right.
and their website. Actually, they have a phone number. They have the day that
Right.
it's usually Thursdays that they're going to be spraying.
Mhm.
And so they do call. They look at the map. They can ask them for spraying at their house.
Mhm.
So
Yeah, I
people
know
do
this
call.
information. It's just more, as I said, that's the interesting thing, right? There's so much information, but you just can't put your hands on it sometime as a resident. So, I don't want to take up all your time because I told Regis that it would be like a 20-minute discussion. Um, but what our goal for these types of meetings is actually to have this conversation of saying, how do you become more cognizant of reaching out to a broader set of people? And I don't want to put words, but I did take notes. So I know you have so many wonderful programs. And the question for me is, or for our group, I would say, is are you being as effective as possible in terms of reaching as many people as possible? And I think Roxanne and Caroline and Mary, you've all said, you know, there's no one silver bullet, right? And so how do we start to think more holistically about those types of things? And Caroline, you talked about inclusive communication being a goal for your this year and maybe beyond. And like I know you have your website, your Facebook, and your whatever and social, you know, whatever the social worker and all kinds of other things. And you're doing so much work. How do you make sure that the people who need to know get to know? You know what I mean? Because a lot of times it's the person who may be working in a supermarket and, you know, unlike me, where I will go to my doctor and she'll say, "Oh, it's time for a flu. You come in, you got to get your flu shot." And so I have a lot of methods of it, but what about other people who may really depend upon these? The elderly is, I know, another group that might, and you know, might really need to, may not be as mobile in terms of getting out of town. So,
Yeah.
I
So we
do,
do,
I just,
do give the flu shots to people who are unable to come out to the flu
mhm,
clinics. But
mhm,
if you could send me some suggestions after this meeting of how to connect with the community, if you have
mhm,
suggestions that
mhm.
that you can send our way, that'd be great. I'd love to hear
Well,
from you.
I would definitely start to do that because as we are hearing back from other groups about what they're doing in
Hmm.
terms of outreach, we will certainly pass on those information. I mean, and I'll tell you, of the groups we've talked to so far, which is probably five or six, a lot of them have been talking about things like um, making their websites more accessible in terms of just making sure that when you go to it, that you have a way to navigate it
Hmm.
better. Because a lot of times, and I'll just say this, I mean, I go to the town website probably more than most people, and I find it challenging to really think about how to get through. And then other people have are starting to think about like frequently asked questions. Like what are events, for example. Like just put it up there, events. Um, and then I like the fact that you are advertising. And one of the thoughts that has come up has been, you know, a partnership maybe with the chamber or with local businesses to maybe have like a community board where things could just be posted in at their sites. Because a lot of times, you know, it's not that many people won't go to the website. So anyway, but I will definitely put some of those together. But what I would ask is that because I think that you all have, you know, are, as I said, you're more experts, you know what people are asking for. Um, you know, we're not trying to be, I will never be a health public health professional, but I know what I'm looking for. And so my assumption is that other people, I mean, I know that some of the uh, like I was very well got a great education about from the Milton Coalition when you know we're doing all the drug like what are some of the signs and what are some of the resources that are in the community, all of those types of things. You know, you need them if you're dealing with a certain issue, right? But a lot of times you don't even know how to spot things. And so I've read those articles very, especially from the paper, and I've actually sat in on a couple of meetings. And so I just think it's, you know, there's a lot of opportunities for us to do a better job, and we're not trying to make your work harder. It's like maybe what are the best practices, right? And a lot of people are talking about like how do you outreach better to people. So I certainly hope to be a resource and as your liaison. And so we hope that we will have a dialogue with you periodically to see how you're going. And Carolyn, I will communicate with you and Roxanne specifically as leaders, and I know the whole board too. Hopefully you'll CC them around like what are some more specific things that you're doing so that we can all highlight things better and make sure that everybody understands what's going on. So
Thank you.
Thank you. I was just going to say, the other thing that was not mentioned, which probably should have been, is that there's a relationship with the hospital too. And
yes,
the hospital has a lot of resources that,
right.
Caroline is, periodically has had meetings with the hospital, right, as well. So I
Mhm.
think, that's a resource as well for the community.
Yep,
They have interpreter lines and so forth as well. Um, and so I just wanted to point that out before
that's
you
such a
left,
good, yeah,
because not every community has a hospital in it. So I think
right.
that's definitely something, that can be an asset to the
Oh, I
process too.
definitely.
So, to get messaging out on different events and,
Mhm.
in different languages as well. So,
Mhm.
and I wanted to thank you too for reaching out and coming to the committee and spending time with us here on the board
Well,
with
I
all your
think
work.
No, I thank you for having me and being so open to this conversation. So I really appreciate it. And as I said, I will periodically check back in, and I'll specifically check in with Caroline and you, Roxanne, as we to share some best practices and that we're hearing from others, maybe, or that you can share with me, because I know that I was just, when you talked about these 7 or 8 towns that you were doing, they may be doing things that we should be spreading the opposite way in terms of other organizations. So thank you very much.
Patricia, sorry to interrupt. So I know we mentioned the trusted networks like churches, schools,
Mhm.
libraries, community centers, but if you can think of any other network,
Mhm.
entity, put it in your
I will.
write-up as
Mhm.
well, because that's when you're going to really hit a number of people. So
Mhm.
if there's any other like community entity that you can think of, put
Mhm.
it in the write-up to Caroline too.
I will. That's such a great idea, Mary, because like that's one of the things, like these small networks that if you can get to like one or two of those people, they have a different network than all of us have. So
Right.
that's such an excellent idea.
Yeah.
Thank you for that.
Thank you.
Mhm. Well, I'll let you get back to your business and I appreciate the time and we'll be talking.
Sounds
Thank
good.
you.
Thank
Thank you
Take
for your
Look
care.
forward to
time.
Thank you.
connecting.
Thank you for
Bye.
coming.
Take care.
Thanks.
Bye.
Bye-bye. Okay. So we're gonna move on to the director's report. So 68 Smith Road, I actually did get an email from them that they're in the process of replacing all the windows. They said they already hired a windows certified company, Reliable Roofings and Siding, and they're going to be working on the windows. So that's good news. 5 to 9 Thatcher, I have no new updates. I'll reach out to Mr. Joyce again to see what's going on there. Nothing else has come in. East Milton Spirit and Wine, they're abating the asbestos in the basement, and they're in the process of doing that. 333 Thatcher Street, a housing correctional order was sent, and town council is working diligently on that. They have till April 20th to repair the violations, and then if they don't, they'll be going to court. And just the take one, leave one shelves, they've been becoming bare, actually. Lisa's coming in and stocking them, and Ann's getting some more food. So we're seeing that people are in need of food. We might have another food drive. I know Ann has mentioned it maybe in April or May, but we've had to purchase some food to keep the take one, leave one shelves stocked. And then just a couple of updates about new establishments that are coming into Milton and some that have closed. So Cooking with Stephanie is closed. And I don't know if you know where Cooking with Stephanie is, but it's right behind the old Bents in the back. And we're going to have a new, it's called Tres Leches Factory food establishment in there. And they're going to be serving cakes. So it's called Tres Leches Factory. And I'm looking forward to that.
Caroline, have you ever had a Tres Leche cake?
I have not. Have you?
Yes, I have. They're very good.
They're
Oh, okay.
delicious.
Yeah, they're delicious.
They're delicious.
When I
Okay.
went to the pre-opening, the owner, Salome, she said that she also does gluten-free stuff. So
Oh,
Good.
I didn't know
Good to
that.
know.
Oh, that's wonderful.
Good.
Okay, I'm going to check it out. Didn't know that. That's great. Great to know. And then we've got a lot of stuff from Julianne's new food establishment, and reviewing that. They've already started construction, so they've given us enough paperwork to start construction there. And we're still waiting for some more information to approve the full plan. And then the third one is called the 2 Pence Market. And that's in Lower Mills with a Bank of America.
oh
And
yeah.
so they have submitted some paperwork to Carolyn. And so we're currently looking at all that paperwork right now. So, and I just wanted to say, you all know that Emily Connors has resigned. She gave her 2 weeks notice and she went to Needham. So we internally posted the assistant health director position, and we had one person who applied. It was Carolyn Ho.
Oh.
And so I'm
Yay.
happy to say that. And so I'll talk to you, Roxanne, and see if we can schedule an interview with Carolyn and going forward. So.
Well, good
And,
luck to Emily if you're talking
yes.
with her. Wish her
Yeah.
well.
Yes.
So Emily went to Needham, closer to her house in Wellesley, and she's going to get more pay, and she has a more flexible schedule for her. She can stay home 1 or 2 days a week, and it's more data driven. And that's what she went to school for, like epidemiology. So she's looking forward
Okay.
to a new start in Needham. Yeah.
Carolyn, I just have a quick question for you. With
Sure.
regards to the flu vaccine, the flu clinics and all that, did we end up with a lot of flu vaccine at the end, or how did we do in the end with that? Any idea? And also, were you seeing a lot of cases this year?
Of the flu?
Yeah.
They definitely decreased the flu cases.
Oh yeah. Yeah, we're not seeing them now.
We did see them. We do have quite a number of doses. We're going to have to decrease again what we're ordering. So I'll have Sue count them, and
Yeah.
I can let you know at the next board meeting. But yeah, we still have the seasonal flu clinic in the fridge. Yeah, the seasonal flu vaccine in the fridge.
Yeah.
Yeah.
Okay.
So I think, and for the past couple of years, I keep on decreasing it. So I'm going to have to
Well-
decrease it again.
Well, I think people are just going out to like the CVS and the
They are.
Walgreens and the
Yep.
and Wegmans, and
Right.
everyone's offering it so early.
And we can't compete with that.
Right.
Yeah, so we don't get it from Sanofi until late in September, and we can't plan the clinics until I have it in the fridge.
Right.
So that's the downfall there. Walgreens and CVS is getting it in August, and then they're offering coupons to entice people to get it. So it's a lot of competition. In the old days, there was no competition, but yeah, you're right.
Right.
That,
Plus, it's better to get it later anyway. So, I mean, I think August is sort of early.
yeah, I agree. I
Yeah.
agree.
So, okay.
Anybody have any other questions? Anything? We'll schedule our next meeting date.
Right.
Take a look at the calendars.
Do you anticipate anything coming up?
There's no septics coming up, is there, Carolyn? That you know of?
I don't think so. I know we have 2 perk tests scheduled, but because of the snow, it got delayed. So as of right now, nothing.
Easter's falling on April 5th. I don't know if you want to have it the week after. Uh-oh. The 13th? Or the end of March?
That sounds, April 13th sounds okay. Doesn't it? Or no, is that?
Let me just look at something. Well, I mean, you could do a quick one the end of March if you have anything. I don't know, or do it, because then you'll be in April. You know what I mean? Otherwise, you're going to be meeting maybe, possibly. Well, you might still meet twice in April when you rearrange the board and everything.
Mm-hmm.
Well, are there any date? Do you want to figure out? Are there any dates that don't work for people that they know right now won't work?
Not quite. Oh, April, end of April. John's having his knee operated on, so I'll be out of commission in the end of April, I think.
Okay.
April 29. But any other
Okay.
time.
What are you looking at, Carolyn?
Do you want
Is
to
the
do
day
that
after,
13th?
the day or two after Easter? I don't know. Is that not good for people?
Okay for me.
That's fine for me.
What do you think, Caroline?
Well, Easter's on the 5th. Do you want to have it on the 6th, the day after Easter, instead of the next week? Yeah.
Want to aim for that?
We could have it on the 30th, March 30th.
I'm not sure about the 30th for
Okay.
myself.
Okay.
So it's either the day after Easter on the 6th or the 13th.
Let's do the 13th.
13th?
Okay.
13th?
If anything comes up before then, you can be in touch, but let's aim for the 13th, and that's fine.
Thanks.
Okay.
Yeah. Okay.
That sounds great.
All right.
All right, so adjourn at 8:03.
All right. Good night,
Okay.
everybody.
Thank you.
Good night.
Thank you.
Thanks.
Bye.
Bye-bye.
Everyone.
Bye.